By signing the Inflation Reduction Act, President Biden is delivering on his promise to build an economy that works for working families, including Black families. The Inflation Reduction Act lowers prescription drug costs, healthcare costs, and energy costs. It's the most aggressive action we have taken to confront the climate crisis. It'll lower the deficit and ask the super wealthy and corporations to pay their fair share. And no one making under $400 per year will pay a penny more in taxes. President Biden and Congressional Democrats beat back the special interests to pass this historic legislation that lowers costs for Black Americans and their families, advances environmental justice while building a cleaner future, and grows the economy from the bottom up and the middle out. Lower health care costs. The Inflation Reduction Act, IRA, will lower health care costs, including prescription drug costs, and expand health insurance coverage for Black families. Lower prescription drug costs for seniors. Americans pay 2 to 3 times more for their prescription drugs than people in other wealthy countries. High prices contribute to racial and ethnic health inequities. Among adults 65 and older, Black Medicare beneficiaries were roughly 1.5 times as likely as white beneficiaries to have trouble affording medications, and about 2 times as likely to not fill needed prescriptions due to cost. For example, a recent study of shingles vaccination rates among older Americans showed non-Latino white Americans were over 2 times as likely to have received the shingles vaccine than Black Americans, due in part to difficulty affording the shingles vaccine. The Inflation Reduction Act will help close the gap in access to medication by improving prescription drug coverage and lowering drug prices in Medicare. The law caps the amount that seniors will have to pay for prescription drugs they buy at the pharmacy at $2,000 a year, giving peace of mind to seniors who no longer have to worry about spending thousands and thousands more on prescription drugs. Caps the amount that seniors will have to pay for insulin at $35 for a month's supply. Provides access to a number of additional free vaccines, including the shingles vaccine, for Medicare beneficiaries.